COVID-19 exposure during flu vaccination. My name is Carmen Sanders. I am a member of the Makah tribe, and I'm a public health project coordinator with the National Indian Health Board. A few things before we get started. Everybody is muted, but we want to make sure to remain muted during the duration of the presentation. The presentation is being recorded, and the slides and recording will be available at NIHB's COVID response webpage. And today we're grateful to have two speakers with us. We have Lieutenant Akinsiku from the Fort Defiance Hospital, as well as Dr. Michael Bell, who's a Deputy Director of CDC's Division of Healthcare Quality Promotion. And we will have time at the end of the presentation to answer any questions. So please type your questions into the chat and we'll make sure to get those to our speakers. And with that, we'll begin with Lieutenant Akinsiku.
Hello, everyone. I'll go ahead and share my screen. Okay, can you see my screen?
Yes, we can.
Oh, okay.
Thank you.
Thanks for joining us today. My name is Lieutenant Oluwabukola Akinsiku. I am a pharmacist. I currently work at Fort Defiance Indian Health Hospital, and I manage our pharmacy diabetes clinic and tobacco cessation clinic, and I also staff our inpatient and outpatient clinic. Today I'll be kind of opening up. I feel like I'm the warm-up act here because I got most of my information from the CDC website, so I'm excited to hear Dr. Bell's presentation as well. So I'll be talking about minimizing potential COVID-19 exposure during flu vaccination and kind of tying it into what we're currently doing and my experience with it as an outpatient pharmacist. So the objectives for the presentation are to review the importance of receiving an influenza vaccine during the COVID-19 pandemic, identifying and comparing patients that should receive the vaccine versus patients that should defer, and discussing infection prevention strategies for administering the influenza vaccine during the COVID-19 pandemic. So I'll start off with just showing where we currently are. I got this from the New York Times website, and just kind of shows how far we've come since the pandemic began, and just to show how serious it still is, with cases still rising, deaths still increasing, and hospitalizations still increasing as well, which we see here. This is one showing the trends for influenza-like illnesses reported in outpatient settings. And it shows trends from previous years and the trend for this year, which is still pretty low, but we anticipate that it's gonna rise, and which is why I think this presentation is important and key, so that we can inform people and our patients that the flu season is coming and we want to get as many people protected as possible before it really starts to rise. So I got a question prior to this from Carmen, and it was, what type of outreach and education are you doing with the community to let them know the importance of flu vaccination, as well as reassuring patients that there are safety protocols in place to help minimize SARS-CoV-2 infection? So from our hospital standpoint, I know they've been working with the marketing department, which has done a great job in terms of putting information on our TMC Facebook page, stressing the importance of getting a flu vaccine. On our website, the hospital website has a information of where you can get the flu vaccine around this area. We had drive-through flu clinics in the past month in October, we also had a Fluorescent Park event, so something kind of fun themed, so people could come in. That was around Halloween, I believe, to come drive up and get their flu vaccine. There's signage around the hospital encouraging people to wear masks, get a flu shot, physical distance, and to wash hands and to sanitize. And also there are pamphlets in the front entrance when patients walk in that has information on COVID-19 and what the hospital is doing. So that answers that. So just again, stressing the importance of getting the flu vaccine. The flu virus and the virus that causes COVID will both spread during the fall and the winter. And it is possible to have both the flu and COVID-19 or other respiratory illnesses at the same time. Flu vaccines will reduce the risk of flu illness, hospitalization, and death, and this will save healthcare resources for the care of patients with COVID-19. So moving on, should everyone be coming in? Should we be advising everyone to come into our hospital right now to come get the flu vaccine? And I'm just speaking on this from a outpatient pharmacy perspective and ambulatory care perspective. So what we've always recommended is that everyone 6 months and older without contraindications come in to get the flu vaccine. This year in particular, we're encouraging essential workers, which include people like me, pharmacists, healthcare workers, tribal workers, people that work in healthcare to get the vaccine. People that are at increased risk for severe illness from COVID-19, such as patients 65 years and older, or people with underlying medical conditions, and also people that are at high risk for influenza complications, which is an additional subset. So like infants age 6 months and older, pregnant people, children with neurologic conditions. So just a big emphasis on making sure people that could really have severe illness or complications are vaccinated. So there are some people that we may not tell to come in right now to come get the flu vaccine. So if I'm working in my diabetes clinic and I'm calling patients and I'm talking to patients, if a patient has tested positive for COVID in the past 10 days, we want to reduce exposure. So that might not be a patient that we want to come in right now to come get the flu vaccine. Also patients that are still symptomatic and have not met the criteria to discontinue isolation, which includes 10 days after symptom onset, 24 hours with no fever without the use of fever-reducing medication, and are no longer moderately to severely ill. And patients with known exposure to COVID patients until their quarantine time is over, which I think is changing now with CDC recommendations, but had been 14 days. There are some different considerations based on if the patient is already in the clinic or if they're in the ER or if they're inpatient. So for the most part, patients that are not symptomatic COVID-19 can be vaccinated based on those recommendations if they're already in the facility versus patients with symptomatic COVID that may still be acutely ill or moderately to severely ill. We may want to still wait on as well. So just wanted to point that out. So the main part of this presentation is getting a flu, actually coming in and being safe and getting a flu vaccine during the COVID-19 pandemic. How do we do this safely? How do we not increase exposure to people? How do we make people feel comfortable and feel safe to come in? What's the message? So we'll go ahead and talk about that. So the CDC guidelines for patients is something that we encourage. It's similar to if they're going out to the grocery store or going out for essential services, making sure that they're washing their hands often for at least 20 seconds or using a hand sanitizer that contains at least 60% alcohol. Avoiding close contact with people outside of the household, making sure to stay at least 6 feet apart from other people, which is about a 2 arms length. Making sure people that can wear a mask do wear a mask and wear a mask appropriately, meaning that it covers the mouth and the nose. We have some signs in the hospital saying that a mask is not a chin guard and it's not a nose cover, but it has to cover both the nose and the mouth. Making sure coughs and sneezes are covered, making sure to regularly clean and disinfect, monitoring your health daily so that you know if you are sick. And if you are sick, then we would recommend staying home until you feel better. So that's for patients. So we'll move on to healthcare professionals. What are we doing? You know, because the safety of healthcare professionals is important as well. We have to minimize our risk. If we get sick, we can't take care of patients, and we're all needed during this time. So it's important that healthcare facilities have a way to screen when people come in to the facility. And that includes temperature checks, COVID-related questions about if the person is symptomatic or has had exposures or is awaiting a COVID test. Limiting points of entry, so having actual entrances where people can come in so that they just can't come in through anywhere, and having check-ins during those points of entries. And then in places where patients have to be triaged, having plexiglass to have some kind of physical barrier to reduce exposure. Again, we're emphasizing the importance of having masks for patients over the age of 2. And again, the importance of hygiene. And then for staff that are going to be given a flu shot, making sure that they have proper PPE. And you know, that may not be everything that's used in maybe an inpatient setting for a provider that's taking care of a COVID patient. You know, it's having a mask or having people wear face masks all the time when in the facility. Having eye protection for places that have moderate to substantial community spread, which I think is a lot of areas right now. And then there's an optional for eye protection in areas that have minimal to no community spread unless otherwise indicated. But I think for most places we have pretty significant spread, so the eye protection is helpful. Another way to kind of reduce crowding is to make appointments so that you don't get an overflow of people that you cannot contain. Making sure that we have enough staff and material so that the process is quick. We don't want people crowding and waiting, you know, because you have to look for something, you have to look for gloves. You want to make sure you have enough material. Limiting the amount of people that can enter or be in certain areas where the vaccines are being administered at one time. Having unidirectional signs, we have like 6 feet signs where people can stand that have them 6 feet apart, or even like our chairs have, we space them out so people are not close together. So social distancing between patients. And I also saw a recommendation for, if feasible, separating the time and area for elderly patients or patients with increased risk of complications from COVID. So there are 2 main ways that you can give the flu vaccine, and we have the intranasal flu and we have the intramuscular vaccine, which there are several different types of that from different manufacturers. With the intranasal flu, gloves are essential to decrease the likelihood of coming into contact with a patient's mucous membranes and body fluids. And it's important to change gloves between patients in addition to performing hand hygiene, which includes either washing hands or using sanitizer. Administration of the intranasal flu is not aerosol generating. It's not a aerosol generating procedure, so doesn't require N95. So a face mask is sufficient for that. With the intramuscular vaccine, again, just making sure to change gloves between patients and performing hand hygiene after every patient. And we still want to make sure we're following what we do normally, the standard, reviewing a patient's immunization history and assessing for the need for immunization, screening for contraindications and precautions, educating the patient to let them know what they're getting, because we'll have in situations where patients already had the flu shot and they come in and you're just so focused on, I need to get everyone a flu shot. You want to make sure they know this is the vaccine that they're getting. Once everything is clear and it's okay for the patient to get the vaccine, then you want to prepare it, administer, and documentation is important. So my favorite part, since I'm pharmacy, is the counseling pearls. You want to make sure patients know what to expect after they get a flu shot. They might be redness, pain, and swelling at the site of injection. And some patients may have systemic reactions, including fever, chills, and headaches, or body aches. And that's important to know at this time. Some patients may say, oh no, I got the flu shot, that gave me COVID. So it's really important to let them know that this is what you may expect a couple days after getting the vaccine. So managing those reactions is being aware of what to do. If someone does develop a fever, it's recommended that they stay home until they're fever-free for 24 hours without using fever-reducing medication. If the fever does not recover within 72 hours or COVID symptoms develop, then they may want to contact their healthcare provider. It's important to know that the flu vaccine takes about 2 weeks before immunity develops. So during that time, it's still possible to be exposed. It's still possible to come into contact with someone that has the flu and for it to spread. So it's still possible. It's still important to be safe, to hand sanitize, to wear a mask, and just know that there's still a time frame between when you get the vaccine and when you will be protected from influenza. And to stress that the flu vaccine is to prevent, is to protect from influenza, not COVID-19. That's a different story. So in summary, just again, an emphasis on making sure to encourage the flu vaccine for everyone that's eligible. If they're able to come in and they don't have any reasons to defer, it's very important that we promote getting the flu shot right now before we see surges in influenza as we are seeing in COVID. Assessing vaccination status of all patients at every healthcare visit, and encouraging vaccination of all eligible patients. And in addition, following CDC guidance to prevent the spread of COVID-19 in healthcare settings, and communicating with patients and families about how they can be safely vaccinated during the pandemic. So my resources were all CDC pretty much, the pandemic guidance, flu season facts, a little bit of NPR and WHO. Thank you for listening.
Thank you, Lieutenant Akinsiku. Next up, we have Dr. Michael Bell with the CDC.
Thank you, Carmen. Lieutenant Akinsiku, that was wonderful. I really enjoyed your talk. It was perfect. I'm also very relieved that you put the slides up because I thought for a minute there I was supposed to be doing it and I was doing something wrong. Thank you, everybody, for letting us join you today. This is very exciting for us. Thank you to NIHB. We love this partnership very much and are very excited to share information with you and also hear your thoughts and questions. We look forward to incorporating what you tell us into the next things that we do. So this is a very important opportunity for me and for my colleagues. Can we have the next slide, please? Oh, there it is. These are our learning objectives for today. I'm going to say a few words about screening, a little bit more about PPE, although Lieutenant Akinsiku did a very nice job of covering the details. I'll maybe share some rationale behind the recommendations, and overall sort of discuss the process of safe influenza vaccination this year in particular. Next slide, please. And here we have a quick, slightly shameless plug for Project Firstline, which is the platform that's allowing us to have this collaboration with NIHB. I just checked. If you put in Project Firstline on a Google search, the CDC websites all come up. So if you have an interest in learning more, please do take a look, and we'll be happy to share more information. Next slide, please. So getting into the meat of the matter, SARS-CoV-2 is the virus that causes COVID-19. So they're the same thing, basically. One is the problem, the second one is the disease. The challenge that we have with COVID-19 is two things. Number one, it spreads very easily from person to person. Just like flu and other respiratory viruses, it's easy to spread around. And the second challenge that we have is that people with no symptoms at all can be infectious. So you can't necessarily rely on somebody having a fever or symptoms to tell you that they're infectious. We need to be cautious with everybody that is not in our immediate household when it comes to interactions so that we don't risk accidentally being exposed. The reason we use certain precautions in hospitals and different precautions elsewhere is the intensity of exposure, how much exposure we're likely to have, and the nature of that exposure. And so for taking care of a known COVID-19 patient, we use an N95 respirator, as well as other personal protective equipment, eye protection, gowns, and gloves. Vaccinating for flu is a very different thing. We want you not to be taking care of COVID-19 patients as part of providing flu vaccine, right? So the main thing is to make sure we're not accidentally mixing sick people or people who might be sick with either our staff providing the vaccination or other people coming in to receive a vaccination. Next slide, please. And so the way we do that is with infection control. We've all heard about infection control. It's kind of like the air we breathe. We don't really think about it until, you know, the ventilation is off and it's too hot, and then we think, gosh, it's awfully hot in here. That's the same thing with infection control. We try not to forget about it, but most people do unless there's a problem. It's important to remember that infection control is something we have to use all the time, even when we don't recognize a problem. It's a preventive measure. The most important thing here is to think about the importance of source control and screening. The other things are important too, and I'll talk about those in a second. But first and foremost, source control. Source control is what we do to keep people from breathing out infectious material. All of us create tiny little droplets when we breathe. We create even more droplets when we talk, and we create a lot of droplets when we shout or sing. That's why we've seen transmission of COVID-19 during choir practice. We've seen it during sporting events, right? Anytime people are raising their voices, they are more able to generate a fine mist. We can't see it when we're talking or breathing, but think about it. On a very, very cold morning, when you go outside for that first moment and you breathe out, you see a mist, right? That is that air that you're breathing out, and it is a mist of your own respiratory secretions. And it doesn't stop right here. It goes for a foot or two. You already heard Lieutenant Akinsiku talk about the 6-foot distance rule. That's in order to try and keep people from breathing on each other and sharing those droplets. One thing I noticed, you said 2 arms length, but if you have stubby little arms like me, I have like little chicken wings, then it might be 3 arms length. But that said, we want to keep people from spreading their respiratory droplets. The best way to do that is to use a simple cloth mask over your nose and mouth, like we heard, all the time. And that's for everyone in the community. The exception here, there are 2. One is little tiny kids under the age of 2 who really can't necessarily do it. I've seen some. If you have a 2-year-old who's able to keep a mask on, by all means, that's great. We just want to make sure that no one is harmed by a mask. So if somebody's unconscious or has physical capabilities that limit their ability to take their mask off if they're in trouble, then we don't want them to use a mask. But 99% of people in our community should be able to use a mask, and we want them to keep them on the entire time they're coming for a flu shot. So before they arrive, they put it on, they keep it on until they leave. The only time that they would take it away is if they're getting an intranasal vaccine, in which case they would just lower it to expose the nose, receive their vaccine, and then cover again. So that is the most important thing. If people aren't releasing infectious droplets into the room, then the risk for everybody goes down. What we know is that simple cloth masks can reduce the amount of stuff we release by more than half. And that is terrific. It's got no side effects, it's cheap, it's easy to do. And so we really want people to remember source control. One area to not miss is source control for you and me, for the staff that are working. We've seen many examples of individuals who were exposed at home, either from their children or relatives, and then came to work and exposed other colleagues, other coworkers in the break room. And so to prevent that, we really want to remind folks to keep their source control mask on while they're working. For healthcare workers, we recommend a medical mask rather than a cloth mask. It provides more protection against splashes. And so it's a protective piece as well as a very effective way not to spread droplets. So source control is thing number 1. Thing number 2, as you heard, is having a way to do triage and screening. I'll say more about that in the next slide set, as well as the other 2 components, which is PPE and hygiene. Next slide, please. So triage and screening, this has to happen before the appointment. I think it's really valuable if there's a way to talk to your community and let them know what the plan is going to be. This happened when I went to my dentist. She called and said, look, we're doing things differently. You're not going to come in until you come to the parking lot and send us a text message or call us. And then we will tell you when it's time. You're going to wear a mask the entire time you're there, except when you're having your teeth cleaned, and then you're going to put the mask back on. And all of that was clear before I went to my appointment. And so the same thing for vaccination, letting the community know what the expectation is very helpful. The second thing is that you want to make sure that there's a process to tell people who are sick that this is not where they should be. Separating sick people, ill people, from the people coming for immunization is important. Back in the day when I ran a clinic, a lot of times there would be immunization patients waiting in the waiting room along with everybody else. And during COVID, this is not what we want. We want to make sure that if people are seeking care for illness or symptoms, they're in a different area with appropriate spacing. If there's any way to avoid having people wait in a waiting room for their immunization, that's the best thing of all. Having them arrive just in time for their appointment, give them their immunization and let them go before the next person comes. That kind of process, I think, is the best. We just had our flu immunization program here at CDC. We did it in a big parking lot. It's covered and it's out of doors, so there's great air exchange. There was a nice set of lines made with tape, and people waited in their car until it was time for them to come stand in the line. And then one person came through the line, and when they came and finished, then the next person came. that kind of process can be replicated in your settings, no matter where you are. You might have to be a little bit creative and figure out the best way to do it. You also have to deal with weather. In some places, you have the luxury of being out of doors, having people wait out of doors. If it's cold and snowy, obviously there has to be a different solution. But the same kind of thinking is what we want to go for. We want to reduce the amount of time people are together. Even though they're wearing their masks the whole time, we want to reduce the time that they're sharing space. The situations where you absolutely have to have a waiting room were covered earlier, as I said, by Lieutenant Akinsiku, in terms of all of the specific details of separating spaces and improving the ability for people to keep their hands clean. And I would recommend having somebody in charge of the waiting area to remind people to keep their source control masks on. The best approach, though, is to reduce the use of the waiting room so that mostly people are coming just in time. That is the best approach. At the bottom, you'll see the point about toys and reading materials. In this time during COVID, not having any shared things like toys and magazines is a good idea. I would put them all in a box in the closet until we come back to normal and don't have to worry about sanitizing everything because kids touch everything. Next slide, please. So we talked about having a plan for waiting. We talked about separating ill people from the people who are coming for vaccine and ensuring everybody that comes in has a mask. Next slide. And now let's talk about the actual practices that we do. We recommend obviously hand hygiene before immunization, putting on gloves, using a medical mask. The medical mask can be the one that the healthcare provider is using as source control the entire time they're there. They don't need to get rid of it after every patient. And then if you're in an area where there's a high level or a moderate level of COVID transmission, then you should also cover your eyes wearing a face shield. And that's just an added level of safety to make sure that you're not accidentally receiving droplets to your eyes. In areas where it's low level transmission in the community, the eye protection is optional because the likelihood is lower. I will say that the issue of hand hygiene before gloves comes up a lot. And so I'll remind everyone, the reason we do this is because gloves are in a box. And if I have dirty hands and I stick my hands in the glove, in the box, I've made many gloves dirty, right? And so whoever uses the next pair of gloves might pick out a dirty glove that I made dirty, and even worse, maybe touch a patient and spread germs that they can catch an infection from. So we want to make sure our hands are clean before we reach into the box. And then the other piece is when you take your gloves off, you immediately want to do your hand hygiene again. Alcohol gel is perfect. It's good for your skin because it doesn't dry it out as much as soap and water, especially during the winter months. Next slide. So getting to the after action piece, we talked about removing your gloves promptly and doing hand hygiene. Cleaning and disinfecting surfaces is another component of this. And it'll depend on how you're working and where you're working. But if there is a tray table that you're using, making sure that it's wiped down with a standard hospital disinfectant wipe, that's a good way to do it. You can do that with your gloves and then take everything off at the same time and clean your hands. It's fine to do that. If there are any other surfaces that are being touched by patients or by the care provider, those should be wiped frequently as well. The good news is that COVID-19 doesn't require anything special. The same disinfectant products that you use normally in a healthcare setting are very effective against COVID-19, and the same alcohol gels and soap and water that we use for hand hygiene work very well too. You just need to remember to do them. Next slide, please. We talked about hand hygiene. Next slide. And we talked about Project Firstline. So I think that is everything that we needed to present. I just saw something come up about disinfectant products that have to be on EPA List N. That's correct. List N on the EPA contains all of the things that are officially approved for coronavirus. COVID-19. And so those are the ones that you should be buying. But even at home, it's important to remember that those are the ones that have been tested and approved with a stamp of approval. So for a healthcare facility, use those. But I find it very reassuring to know that whatever disinfectant I'm using in my kitchen, whatever soap and water I'm using at home for my hands, those things also do a great job of stopping COVID-19. So patients should also be encouraged to maintain hygiene both at home and on their hands. Carmen, I think that's all I have. Yep.
Perfect. Thank you, Dr. Bell. Let's see.
Also, I apologize if I keep looking to the left. We have a thunderstorm rolling through right now, and I keep worrying that we're about to lose power.
Oh, no. Let's see here. I can't get to the question. Okay. And Courtney, did we have any other questions come through?
Yes, I will send them to you right now. I know we have the questions that you received earlier. If you want to start with those, and then I'll send these to you.
Sure, no problem. Let's see, we did have a few questions come through. I may have lost them when I started presenting. Give me one moment.
Okay. Well, I can go ahead and read these while you pull those up that have come
Sure.
through.
That would be great. Thank you.
No problem. How long can you use a cloth or other mask before changing or washing?
I think that's for me.
Yes.
So for a surgical mask, a medical mask, for those of us administering vaccines, we can keep them on as long as they don't get obviously dirtied or get wet and soggy. So sort of common sense, routine approach. But for several patients in a row, if you're providing vaccine, keeping the mask on is okay. Same thing with your eye protection. If you're wearing a face shield because your community has high rates of transmission, it's okay to leave the face shield on, but you do have to change gloves, do hand hygiene, put on fresh gloves. For cloth masks, these are personal products, just like your own clothing in a way, that we want to have be clean, but we don't need to go crazy. There were early on, about 6 months ago, there was a lot of concern about, oh my gosh, is it gonna make me sick to have this cloth mask over my nose and mouth all day? Or because I've been breathing on it or my secretions are on it. But I would point us to think about our own pillowcases, right? We have our face up against the pillowcase all night, every night. And I'm guilty of not washing it necessarily as often as maybe I should. I probably manage every week or so. But during that time, it's not a source of infection to me. And so similarly, if you think about your mask in the same way that you would think about a t-shirt or your pillowcase, it means you don't want it to be put someplace dirty, right? Don't put your face mask down on the floor area of your car or in a bunch of dog hair in the back seat, because that's kind of gross. But at the same time, keeping it clean in a pocket and laundering it once a day, a few times a week, within reason is perfectly okay. Some of it depends on whether it's getting dirty for any reason. If you work in a dusty environment, then you'll probably want to change more frequently. I think in general, if everyone has 5 or 6 masks at home that they can rotate and launder on a regular basis, that should be fine.
Okay, thank you. And I have another question for you, Dr. Bell. We have one that says, if we've seen an increase in COVID cases in the community and we have a limited amount of PPE in our clinic, how can we safely provide the flu vaccine with these challenges?
There we go. So we have across the country been dealing with challenges of supplies. This is a terrible combination really of COVID-19 plus a supply chain problem. So many organizations, many institutions have been struggling with this. First, before I forget, if you go to the CDC website and look up PPE supplies or PPE use for COVID, you can just Google it. It's very easy to find. We have some tools available for how to extend the use of PPE and also to calculate how much you need. There's a burn rate calculator that you can use to figure out where you are in terms of supply versus how quickly you're using those. The good news is that for some supplies, for your mask and your face shield, you can set up your approach so that you put on one mask and a face shield, and you do an entire session of vaccine administration. And that way, only one person is using one set of facial protection during that time. It means figuring out how you're going to make sure that one person is able to do all of these things. And that means setting up supplies appropriately, making things convenient for the person who's doing it. It might mean having an assistant who doesn't come in the room, but is able to hand things to the person who's administering vaccine, that kind of plan. So that extends the use of facial protection and eye protection fairly efficiently. Theoretically, you could probably do a whole day of vaccine administration with maybe 4 sets of those, which is much better than changing after every individual. It also means, though, that you're going to need to plan to have all of your vaccine clients come in one part of the day to one location. And that makes the scheduling even more important. So if people are coming in intermittently during your regular clinic hours, and sometimes they need a vaccine or whatever, then you have to stop what you're doing, put on your PPE, do the thing. In fairness, you're probably going to be doing that anyways for most of your clinic care. But you can be more efficient with vaccine if you say that the vaccine clinic hours are from this time in the morning till this time in the afternoon. Here are the appointment slots. This is the one room, and this is how you're going to enter. This is where you'll get your vaccine, and this is how you leave. And during that time, I will stay there to provide the vaccine with my mask and eye protection the entire time. That still means you need to change gloves. And every now and then we're hearing about places with glove supply challenges. That's a very difficult thing. There's not an easy approach. There are some crisis standards of care that are on our website at CDC, but it would be better to find a way to have enough non-sterile gloves to do this in a clean way. That is the ideal. If there are challenges that aren't addressed by the website, please reach out to us. I'd like to hear about them, and if we can work directly with you to come up with a better solution, we can try to do that.
Great, thank you. And the next question, I think maybe for either of you, and it may have been discussed a little bit during the presentations, but the question is, would it be better to set aside time for elders and immunocompromised people to receive the flu vaccine so they are not coming in at the same time as everyone else?
I can speak to a little bit of that since I mentioned it. I do think so. I agree with that. That was one of the things that I did see in the CDC website. I think about it the same way as grocery stores, what they did for elderlies in terms of having special hours for them so that they're not coming in with massive crowds, just to reduce exposure, because although we are all concerned about COVID-19, we have certain people that are more of a concern because they are at higher risk for complications. And whatever we can do to make it safer for them to come in, because we do want those people to come in to get their flu vaccine so that we can reduce complications for them with both flu and COVID. So we want to make it as safe as possible for them. And we want them to be encouraged to come in. So if feasible, then it would be ideal to create separate times and space for those people that are elderly and at high risk for complications.
I agree completely. I think the approach that Lieutenant Akinsiku just described is the best thing to do if you have to use a waiting area. The alternative is to figure out a way that people can be seen so that they're never with other people, so that there's one person at one time and there's no mixing in a waiting area. And if you do that, then there's maybe a little bit more flexibility as opposed to saying they have to come at a certain time at the end of the day. If it's one at a time, then it's kind of the same, all the time, and for everybody. But if you do have to, because of cold weather or some other practical reason, use a waiting area, then like you just heard, clumping people either first thing in the morning, last thing of the day, or a special day, those are ways that you can maybe make it safer for those people.
Sorry, I lost power, so I may have missed some of the questions that were typed into the chat box. So my apologies for the inconvenience. So I will send Carmen the questions I just got, if that works for you, the ones that I had before I got kicked off.
Sure, that would be great.
Okay. So there was one for Buki, or Lieutenant, sorry, my apologies. I've worked with her before, so okay. Okay. Where'd it go? Oh, are you offering alternate times for vaccination to accommodate those who work and minimize the number of people who come into the hospital?
Right now, we just have a specific time. I think it's 9 to 4 at our primary care. But for those that do work at the facility, we have a separate way for them to get their vaccine. So we have a separate method, so they don't have to come in through primary care. They can go through a separate contract. I think it's Contract Health. I can't remember exactly the name, but they can call and make an appointment outside of primary care. So there's a separate process for employees versus patients. And that kind of helps with separating and giving enough time for our employees versus patients. And I think it can be done outside of the standard primary care times. So that does help.
Thank you. And so I got the questions from Courtney. We have a few for Dr. Bell. One is, how long can you use a cloth or other mask before changing or washing?
I think we covered that a little bit ago. I think, as I said, if you have several that you can exchange, it's fine to use a mask all day and then launder it. If it's still clean the next day and you keep it clean, there's probably nothing terrible about putting it back on. This is all about containing your own secretions. But if you're in a place where, for example, if you're wearing the mask in a place that's crowded and you're worried that it's dirty, then you should wash it right away. But really nothing all that special. Just washing it in the laundry machine or even in the sink with soap and water You want to make sure it's completely dry. I personally prefer those types of linens to be dried in a hot dryer, if at all possible, or outside in the sunshine. Hot dryers and sunshine both do a really good job of inactivating bacteria and viruses. And so just from a general hygiene perspective, those are good things to remember.
Okay, great, thank you. And then we have another one for you. What type of viruses are COVID-19 and the current strain of flu?
So COVID-19 is caused by a coronavirus. That's where the COVID comes in, coronavirus. And coronaviruses are common types of viruses. There are many, many different ones. COVID-19 happens to be slightly different, and so our immune systems don't recognize it yet. All of the colds that we get every year for our whole lives, those colds are caused by a mix of different viruses. Some of them are caused by rhinovirus. Some of them are caused by adenovirus. Some of them are caused by coronavirus. Most of them are pretty similar to ones that we've had before. And so if you get just a slight sniffy nose and everything goes away, it's probable that your body has seen a similar virus in the past and has a little bit of immunity to fight it off quickly. The problem with new viruses, like the COVID-19 virus, is that most people have never encountered exactly that virus before. And so it takes some time for the body to fight it off, and we can get sicker while that's happening. Sometimes the immune reaction is so powerful that the immune reaction itself causes us harm. And that is one of the problems that we've seen in some of the severely ill patients. So short answer, coronaviruses cause COVID-19. It's one type of a common family of viruses, and we're still in the process as human beings of becoming better at dealing with them. Flu viruses, influenza, is a category of viruses of their own. Influenza viruses are sort of a different family. That's why the disease they cause feels so different. We take influenza very seriously because it kills a lot of people. COVID-19 is a terrible pandemic, and many people have died and are continuing to become sick. But in a regular influenza season, 35,000 people in the United States die every year. And that's something that we really want to prevent. If you've not had influenza before, a lot of people say, I had the flu, and really they mean they had a cold, right? They had a runny nose, scratchy throat, and it went away after a few days. I can tell you, the first time I had influenza, I was just out of my residency. I was young and invincible. And oh my gosh, this felt like a truck ran me over. I was working in a clinic, and our clinic nurse looked at me and said, you should go home. And I said, no, I'm fine. I just got here. And then within 20 minutes, oh my gosh, I had muscle aches, a backache, a terrible high fever, a headache. It all just happened like that. She was exactly right. And I didn't get better for about 2.5 weeks. I was literally home in bed for 10 days. And I was in my 20s. It's a really bad disease. And that's why we as a nation work so hard to make sure everyone gets their flu shot, because it's such an important defense. It's not perfect. It's maybe on a good year, 80%, maybe 90% protection. In a not so good year, it's maybe 65 or 70% protection, but that's still a lot better than nothing. And even partial protection might reduce the severity of the illness. And so that's a really important reason for taking the flu vaccine seriously. I never miss it. I'm religious about my flu shots. The other thing about influenza is that even if you manage to get over influenza itself, there can be secondary infections like pneumonia. And a lot of people, especially our elderly, are at risk for dying, not from the flu itself, but from the pneumonia that follows. And so for several reasons, that flu shot is so very important.
Great, thank you. And we're winding down to about the last 5 minutes. I do have a few more questions before we get ready to close here. One is there much evidence that it helps to wipe off groceries?
No. In a word, no. Don't worry so much about wiping groceries. In the very beginning of the pandemic, when people were still trying to figure out how this disease was spreading, I think there was a lot of attention to everything: surfaces, animals, respiratory transmission. What we're seeing is that the vast majority of transmission is coming from infectious people who may not have symptoms, but are still releasing infectious droplets from their airway. And so that's the main thing. That's why we say so much about source control. And then the second thing is, if you touch something and it has somebody else's secretions on it, you can rub your nose or rub your eyes and give yourself the infection as well, which is why we focus so much on hand hygiene. When it comes to wiping groceries or any other surface, it's always good to be clean. We want to remember that everything out there is dirty. The entire world is covered in a little bit of poop, sometimes a lot of poop. And that's just a reality of the planet. So anytime we're handling food, we want to do it in a clean way. That's why we want to make sure that our food is properly cooked to the right temperature, because if there's a little poop on it and we don't cook it well, we can become sick. Similarly, if we're out and about and we touch the handrails at a building or a playground surface, there can be bacteria or viruses on there not related to COVID, but we also don't want to put those in our eyes, our nose, or our mouth, or we don't want to get an infection from a cut on our skin. And so maintaining a clean environment at home, maintaining hand hygiene all the time is always a good idea.
Okay, great. So I have one more question for Lieutenant Akinsiku. Let's see. The question is, what tests are available to diagnose influenza and COVID-19?
At the hospital, we usually just do nasal swabs for COVID-19, and for the flu, we usually do lab work. So that's what we use in the hospital. I'm not an expert on diagnosing. I'm a pharmacist, so if Dr. Bell could speak more to that, that would be great. Usually we just give out the medications, and we counsel on using the medications after being diagnosed. But we can see results from lab work at the pharmacy. We're able to see lab work that shows people that have been diagnosed or tested positive for either one of the viruses.
Yes, so that's correct. We have a very good rapid test for influenza. And so that's the good news. Whether you're in an outpatient setting, an emergency room, most every healthcare location should be able to provide a rapid flu test. That's important because there's actually good treatment for influenza if you catch it. It's better not to have it, and it's better to get a vaccine to prevent it. But if you do have flu, there's good treatment. And so it's important to get the test and find out if you can benefit from that treatment. It can shorten the amount of time that you're sick and reduce the risk to your health. For COVID-19, there are several different tests right now. There's a nasal swab that goes very deep into the nose. It's kind of unpleasant, but it's very effective. And that test is using something called PCR. PCR is basically a way to take a tiny amount of the virus and grow it really fast to get enough of it to identify what it is. That takes about a day. It's a very good test, and it is fairly available across the country now. In addition to that, there are point of care rapid tests that are being generated. Some of them detect a part of the virus, not the gene that the PCR detects, not the inside part, but the outside part of the virus. Those are still in the process of getting widely used and understood. Anytime there's a new test, it takes a while for people to start using them and then become good at interpreting the results. And so those antigen tests, those outside surface part tests, those are things that we're still learning about, but they're available. And then the last thing, there's an antibody test. And the antibody test tests your immune system to see if your body has evidence of having reacted against COVID. In other words, I can test my blood to see if there's antibodies in there that show me that my body tried to fight off COVID. And if you have those, it means you were infected and you got better. That is something that is still being developed. They're sort of available, but it's still not clear how to interpret the results. What we're trying to find out right now is if you have a test that says, yes, your body fought off COVID before, does that mean you're immune now and you don't have to worry about it? Or can you still get COVID again? We've gotten reports around the world of a few people who have gotten COVID twice. And that seems to suggest that even if you have antibodies, maybe they don't protect you completely. So there's still some learning to do. But the tests that are available, the PCR tests, the nose swab, those are very good tests, and now they're quite widely available.
Okay, great. Thank you. And I think we have one more time or time for one more question. If we didn't get to all the questions for all the attendees, please reach out to us and we'll get those questions answered and later. The best way to reach out is through email. So the last one, I lost it. Okay, the last one that we have here is, what is the most effective method the CDC would recommend as an effective process for controlling the patient flow in the facility during flu season?
So I'm assuming this is for an outpatient clinic setting. It's going to be very different if it's a big hospital type setting where you're thinking about patient flow from the emergency department up to the intensive care unit or elsewhere. So I won't talk too much about that, but for an outpatient clinic, I think that it depends a little bit on who you're working with and what the community resources look like. In some situations, if people have cell phones, then you can use phones to control who comes in, when they come in, letting them know that it's time for them to come to the door, things like that. But not every place has a lot of cell phone use. Not every place has good cell phone service. And in those situations, there are other ways of doing it. We can certainly use signage. So posting a sign in the window with somebody's patient number or name, you can give them that as part of their appointment when they call. And when they see that in the window, it can be their signal that it's time to come in. That assumes that there's a safe place to wait. It can be in their car if it's not too cold. If the weather is fine, then they can certainly wait out of doors. But using signs of that sort to control who comes in and when is one approach. The other thing to do is to look inside your facility and think about how people move around. If you have a multifunctional clinic where many different types of care are provided in one place, it may not be possible to have one person come in at a time. And that's going to mean thinking about your waiting area, how to make it as safe as possible. But there also may be an opportunity here to change where you're providing care. If you provide a lot of elder care, then maybe you can find a room that has a different entrance that serves it, that can be dedicated just to those patients to make it a little bit easier to not cross paths with other people. Similarly, if you provide maternal and child care, It may be possible to do that in a separate part of the clinic building. It really does depend on the structure. It can be challenging. The last thing you can think about, or not the last thing, but another thing you can think about is the calendar itself. A way to segregate people is by changing times of day. So if you do diabetic care, rather than spreading the diabetic patients throughout the day, it might be helpful to clump them just in the morning or just in the afternoon, or say that Thursdays are diabetic care day, so that you can take different precautions for different populations. But in general, looking at your facility, how people move, where they go, is an important first step to understand what's going on. And then you can make things better just using practical approaches. One last thing I'll say is, as long as you're looking at your facility, make sure you talk to your facilities manager. Whoever the facilities engineer, the heating ventilation person, talk to them and make sure that the heating and ventilation system has been serviced recently, that it's working well, and that it's creating the right number of air exchanges. So every building should be pulling in fresh air from the outside at a certain rate. And sometimes, if the servicing hasn't been done for a while, you could be getting less fresh air than you need. And right now, with COVID circulating and flu season, would be a really good time to make sure that the air in the building is as good as it can be. Sometimes that means opening windows, but for a lot of modern buildings, if you open the window, the ventilation system shuts off. So talking to the person who manages the ventilation and making sure that everything's working as best as it can is an important thing to do.
Okay, great. Thank you. And thank you, Lieutenant Akinsiku and Dr. Bell, for today's presentation. Just some reminders that this presentation is being recorded. The slides and recording will be available at NIHB's COVID Resource Center. And also be on the lookout for upcoming webinars in the next few months. We'll have additional webinars available. And as Dr. Bell mentioned, this is a partnership with Project Firstline with the CDC and many other partners and taking part in the project. So we'll also have some information available too. We'll send it out as other activities and webinars from other partners will be, we'll send that information as well. Thank you.
Thanks, everybody. Stay safe.
Thank you.